The President Reed will not be available to run the meeting today, so I will do it for him. And what I'd like to do is to make sure that as we move forward, we make sure that we take time, and I'm going to say this kindly, we take time to think about our questions, because I really want us to be extremely ready, because this is an important topic. We're going to have a presentation done from the mayor's office. Mr. Conway, are you going to begin?
I think, shouldn't we call the meeting to order?
No, I'm asking a question. I'm going to ask him. I'm asking a question so that I know what direction I'll be going in.
Madam Chair, I believe Dr. Eccles is a member of the mayor's cabinet that will be answering questions and for the board bill today.
Thank you. I just need to know who's who. Okay. Thank you so much. Let's move forward with calling our meeting to order. Madam Clerk, would you please call the roll?
Alderwoman Davis.
Present.
Alderman Vaccaro.
Present.
Alderwoman Hubbard.
Present.
Alderwoman Negracia.
Present.
Alderwoman Murphy.
Here.
Alderman Coder.
Here.
Alderman Muhammad. Alderman Oldenburg.
Present.
Alderwoman Boyd.
Here.
Alderwoman Middlebrook.
Present.
Alderwoman Clark Hubbard. President Reed. 9 present, you have quorum.
Thank you very much. Do we have any minutes available from the last meeting?
We do.
Yes, ma'am. December the 8th, 2020.
So what I'd like to do is ask if you have had a moment to review them. I'll accept a motion to approve.
I'll make a motion, we approve the minutes from Tuesday, December the 8th.
It's been moved and second. And could you please call the roll for us?
Alderwoman Davis.
Aye.
Alderman Vaccaro.
Aye.
Alderwoman Hubbard.
Aye.
Alderwoman Negracia.
Aye.
Alderwoman Murphy.
Aye.
Alderman Coder.
Aye.
Alderman Muhammad. Alderman Oldenburg.
Aye.
Alderwoman Boyd.
Aye.
Alderwoman Middlebrook.
I saw her.
Alderwoman Middlebrook.
She there.
Alderwoman Clark Hubbard. President Reed. Alderman Muhammad. Alderwoman Middlebrook.
Aye.
Alderwoman Clark Hubbard. President Reed. 9 aye votes.
Thank you very much. We've approved the minutes. If we can, we'll excuse Alderman later on in the meeting. And what I'd like to do is, because I got this information like 2 minutes before I signed on, so I'm not as prepared as I normally am. So we will now move on to the information that's going to be presented to us. And as I understand it, Dr. Eccles will be presenting to us. And Dr. Eccles, if you are ready, please go ahead.
I think we need to do the board bill first, Madam.
You know what? I want to do the board bill
It's
first.
Board Bill 198, or however you choose to do it.
Okay, I want to do it first, but hold on one second, because this all is going to wrap in, okay? And I need to get everybody in place with a couple of statements. So is Dr. Eccles present?
I am present.
Dr. Eccles, can you give us a a preview of the information that's going to be made available to us. And we will entertain the board bill and then continue afterwards. Thank you.
Sure. Good afternoon, members of the board and Alderwoman Marlene Davis. So Board Bill 198 is necessary for the City of St. Louis Department of Health to receive funding from the Centers for Disease Control Foundation, which is the philanthropic arm of the Centers for Disease Control and Prevention, which is the organization that sets the standards for public health activities that are conducted by state and local health departments. Early on during the COVID-19 pandemic, one of the gaps or areas of improvement that I identified was the lack of communication and relationship between the City of St. Louis Department of Health and the communities of faith. That led to the formation of the City of St. Louis Department of Health Clergy Advisory Board, which consists of interfaith group that consists of representatives from various faith groups across the City of St. Louis, which includes but is not limited to Christian, Buddhist, Catholic, Muslim, and several other faiths. Denominations in the City of St. Louis. And so we established the board. We also have co-chairs, which one is myself and the other is Dr. Tammika Turner. And we also have a facilitator, Ms. Lisa Potts, out of the Mental Health Board, who helps facilitate the meetings. The role of the board was to make sure that the health department had good communication with the faith community throughout the pandemic. And this is just a foundation because we also understand that public health isn't limited to non-faith communities, but the faith community actually plays an important role in making sure individuals at the community level receive accurate information regarding information and resources for their health. So the board is in place. We meet regularly, so we have scheduled meetings twice per month. So on the second and fourth month of each month, second and fourth week of each month, we meet to talk about different priorities, particularly public health. And over the last 10 months or so, the focus has been COVID-19 because of the pandemic that we're in. But hasn't been limited to COVID-19. We've also done some work in to improve awareness, increase awareness around HIV and other public health issues. And so the faith leaders have been actively participating in some of the other health departments' initiatives as well. But the primary focus again has been COVID-19 because of the pandemic. One of the things that we realized as well after doing an environmental scan was that there hadn't been any faith-based messaging regarding COVID-19 prevention. So we reached out to the CDC Foundation and they realized the same gap as well. And so part of this funding will be for the health department and the Clergy Advisory Board to work together to establish communication, particularly COVID-19 prevention messaging for faith communities. Again, this has not been done at the national levels or at the local level. And so we will be essentially leading the nation in developing messaging for faith-based communities. The importance of having an interfaith board of different representations among the board members is to make sure that the messaging that is developed can reach different faith groups. So we don't just want to reach Christians, we don't just want to reach Catholics, we want to reach as many people as possible. And so the group will be working together to develop the messaging. In addition to that, a lot of the funding will go towards helping us develop, put together COVID-19 packages for communities of faith. This is also important because over the course of the pandemic, we have identified that a lot of people who need to monitor their signs and symptoms don't have the basic resources that they need, and some individuals also may not have face coverings, at least reusable face coverings. So the funding will go towards helping us purchase the items needed to assemble the care packages, which will include at least 2 or 3 face coverings, hand sanitizer, instructions on how to properly wear a face covering, as well as the messaging that will be created by the Clergy Advisory Board. The total amount for this project is $200,000. So again, the majority of the funding will go towards purchasing those items that are needed for the COVID care packages that we'll be assembling. And the other part will also go towards evaluation. So we need to evaluate the impact that this project will have on the community. And so we'll be conducting a survey for those individuals who actually receive resources through this project. No particular faith community will be directly funded through this project. So this is the ultimate purpose of this project is to purchase the resources needed and to get them out into the community. So the health department will be doing that. We've already issued an RFQ in December where we were able to secure the face coverings as well as hand sanitizers. So those items have been delivered to the city of St. Louis. And so we're waiting for the other items to come in. And as soon as they're received and available, we'll start working with different groups to assemble the at least 10,000 care packages that will again be disseminated or shared, distributed to various communities of faith and tracked all the way down to the end user. And then those individuals that receive the packages will receive a survey. And again, the goal of the survey is to make sure we're receiving information on how the COVID-19 care packages are helping individuals or will help individuals prevent getting infected from COVID-19 as well as other issues that may arise just because of through the pandemic.
Okay, very good. I'm so glad to hear this because we have, it's necessary for us to go take every possible way of getting to the community to try to put some safety out here. So this is really good. Now, for Board Bill 198, I'd like to go to the committee and ask us to be succinct with our questions and move forward. Madam Clerk.
Yes,
Madam
ma'am.
Clerk.
Yes,
Okay.
ma'am.
So I'm not looking at my call list, and I think
Okay.
that I'll have you call each alderperson for questions. Thank you.
Yes, ma'am. Alderman Vaccaro,
I have no questions. Sounds like a good deal to me.
Alderwoman Hubbard,
Thank you, Madam Clerk. I don't have many questions. I guess I'm kind of confused about the process and how we're doing things. It was my understanding we would put the board bill before us. I definitely thank you, Dr. Eccles. This bill was sponsored by myself and Alderwoman Pam Boyd. I think it's a true demand for this type of information to be disseminated through our communities, and I'm definitely grateful that we are able to use these dollars in this fashion at this time when we definitely need the help on the ground just so that we can get through this pandemic. Of course, I don't have any questions regarding it, but I just want to thank you for your continued leadership, Dr. Eccles, during this whole time. And I just want to thank Room 200 and just every hand that's been on deck during this tumultuous time that we've been in doing. And that's all I have. Thank you.
Yes. And let me take this opportunity before we go to the next person to express to our co-sponsors that my need to do it that way had nothing to do with me disrespecting you and your position in sponsoring the bill. Unfortunately, it was something was shared with me that wasn't correct. Okay, so I will apologize to both at this moment. Madam Clerk, could you please move on?
Alderwoman Ingracia.
Thank you. This seems like a really exceptional way to utilize this money. Dr. Eccles, thank you for your work on this. Please thank the members of your health department team who are working on this, and I'd like to be added as a co-sponsor.
So noted. Alderwoman Murphy.
No, just a comment. I said, I'm assuming that this money will also be used to get out the word about safe vaccination, you know, that the vaccination is safe and should be taken, because we always have a group or something that's afraid for whatever reasons to take the vaccination. So we will be able to use this money to promote that also, Doctor?
So that's beyond the scope of the work plan that was
Okay.
established for this project. However, this will complement the other work that we're doing. So we have a project that we have launched, or that we're finalizing with the St. Louis Science Center that we hope to get out soon, which will focus on vaccinations. And then we're also working with some of our other public health stakeholders to get information about the vaccines that are currently approved and also those that are in the pipeline to be approved under the FDA's emergency use authorization over the upcoming months.
Okay. Thank you, Doctor. I would like to be added as a co-sponsor also, if that's okay. Thank you.
Alderman Coder.
No questions. I appreciate the update and the concise summary by Dr. Eccles, and would ask to be added as co-sponsor.
Alderman Muhammad. Alderman Oldenburg. Alderman Oldenburg.
Aye.
He voted. Alderman Oldenburg, we're doing questions right now.
Yes, I'm sorry. I have no questions. My apologies.
No problem. I understand.
Alderwoman Boyd.
Oh, I needed that laugh today. I'm just confused. Help me out, please. Dr. Eccles, bill, I think it's a good bill, but what number is this bill? Because I heard 194 on the Google Drive. This is 198.
It's 198.
Yeah, we're saying 198. Yes.
It's 198.
Okay, so it's so it's 198. Okay, and so I thank Dr. Eccles for pursuing with this for us to try to get as much information in another way as possible. I think you all have been very creative in trying to get that information out. And like I said, I was just confused. It just seems like it went backwards how we did it, but the chair did say that she was given the wrong information. So I support it, of course, and thank you very much.
Alderwoman Middlebrook.
I have no questions. I would like to be added as a co-sponsor.
Alderwoman Clark Hubbard. Chairwoman Davis, that's the end of the list. It's back up to you if you had questions.
Well, I would like to be added as a co-sponsor also.
Noted.
Well, I just wanted to thank Dr. Eccles because he has a leadership ability that is really far-reaching, and his team is working very well with him. And I appreciate all of them for what they're doing. We must take strong leadership right now, because one of the things that we do know is that it's very difficult when you're somewhat limited with funds, but you have to perform a miracle. And so I do appreciate them thinking outside the box and making things happen. I only have one question, and it's not pertaining to the bill per se, but it came up in a neighborhood meeting for me last night. Dr. Eccles, do we have the ability to think along the lines of distribution here locally that could somewhat mirror how the military provides vaccinations? And one of the persons who was retired military said, you all did it by pay stations, which means where the people are located, you go to the people, you can vaccinate faster. You know that because you're a doctor and you were in the military. So if you could explain what they were trying to say.
So that's in alignment with the emergency preparedness operation. So in the city of St. Louis, we have an emergency preparedness program within the health department. And they're responsible for maintaining what we call pods or points of dispensing. So some are closed and some are open. For this, we would likely use some of our, actually we use both to get the vaccine out to as many people as possible. In addition to having our pod partners established, we also have what we call a medical reserve corps, which typically includes nurses, physicians, other healthcare personnel, and even other volunteers that are able to assist us when we stand up our community vaccination events. And so those plans are being fine-tuned to make sure that we have a plan in place when the vaccines are available for the general population so that we can, again, reach as many people as possible. However, we're also mindful of some of the most vulnerable populations who may be unable to leave their home to go to one of the sites. And so we're working with other agencies within the city of St. Louis government, as well as some of our other stakeholders outside of government to make sure that we have good plans in place to reach those individuals as well. Because a lot of those individuals are also considered part of our most vulnerable population. And so we don't want anyone to be denied access to the vaccine, whether that's by mistake or just because of the situation. So we're trying to get as many details as possible in place so that the logistics will be such that our most vulnerable populations, including those again who are not able to leave their home, can receive the vaccine if they opt to do so.
And the last question was, all the home health care agencies, are they being worked with in coordination? Because they're actually visiting people in their homes.
Right. So all individuals who are providing direct patient care on the front are considered to be on the front lines of the COVID-19 pandemic. And so again, we'll be working with those agencies as well as the long-term care facilities and other agencies to get the vaccines to as many people as possible, but especially those who have the highest risk of being exposed to SARS-CoV-2, the virus that causes COVID-19.
All right, I thank you very much. If there are no other questions or comments, then we can accept.
I will make the motion and that we pass board bill number 198 out with a due pass recommendation.
Second.
Previous roll.
It's been moved and second to adopt Board Bill 198 with a due pass recommendation. Requested previous roll. Hearing no objections, we have formally passed this Board Bill 198. And I want to thank you for working with me in my situation today, because I normally would not have done it the way I did. And I just want to give that apology to you again. Madam Clerk.
Yes, ma'am.
We need to go back to the part of the agenda, and we'd like to excuse Alderman John Muhammad and Alderwoman Shameen Clark Hubbard.
Got it.
Do we have any other action required on our agenda today?
Not that I know of. I'll make a motion, we adjourn.
Again, thank you to Dr. Eccles and his staff, and we shall adjourn our meeting now. Thanks, everybody.
Bye-bye.
Bye.
See you tomorrow.
Yeah, oh, that's right. See you tomorrow.
See you tomorrow.